Hello, good evening. My name is Dr. Trudy Ufondu of Snowspirations Global Health Solutions. Thank you and welcome to today's episode of Open Clinic with Dr. Trudy. And this evening, we're going to talk about the reason why you should wait for 18 months before you think of having another baby. So, what is the thinking? What are the basic reasons, the five top reasons you should wait for at least 18 months before you conceive another baby? So, I want you to understand the concept. You have to actually think of 18 months before starting to become pregnant, not delivering another baby, because sometimes we kind of get it mixed up is actually becoming pregnant. Remember that pregnancy takes about 9 months to conceive, carry, and have the baby. So we're going to look at five important points. This particular class is applicable to currently pregnant women or women who are currently breastfeeding their baby, or probably your baby is about 1 year and you're thinking of coming back to have another baby. It's important you understand this and apply it to your next pregnancy. Every pregnancy must be fully planned. A well-planned pregnancy will give you a better outcome. A poorly planned pregnancy can put the baby in danger and also put the life of the mother in danger. The danger might not be in the immediate. The danger might be much later down the lane. So it's important we understand the reason. So I'm going to discuss five important reasons why you should wait for 18 months. Now, there are a couple of exceptions. So there are a couple of women that might actually have a leeway. So we might give one or few considerations, especially regarding your age. So we're going to look at the five reasons, and I'm going to start. Thank you for coming this evening. Now, the very first thing, the recommendation is actually to wait for 18 months. So 18 months, it's 1 year and 6 months, right? So that's 1.5 years before giving birth and becoming pregnant again. The very first factor, the very first reason is to make sure we avoid the probability of having preterm labor, which will lead to preterm birth. Now, when you don't give enough time, when you don't give this 18 months gap, the possibility of having an increase in having a premature baby is high. Preterm babies are babies that are born before 37 weeks. Now, when your baby is preterm, your baby is likely going to be exposed to a couple of medical problems. A preterm baby will probably have organs that are not fully functional, fully formed to take care of the functions of the body. Now, when preterm babies are born, depending on the facilities, they might have medical problems. Most of them will stay in the hospital for a long time. So the more you observe 18 months, the more you observe this recommendation, the more the possibility that your pregnancy in the second part or third part will go beyond 37 weeks. So please, number one reason to avoid becoming pregnant before 18 months is the likelihood of having a preterm baby through preterm labor. So please be mindful of this. Now, second reason for making sure that you have a gap of 18 months is the possibility of having a baby that will be low birth weight, or what we call small for gestational age. So I'll give you an example. So assuming you went for your 20th week abnormally scan, if your baby came too early, if you didn't allow the 18-month gap, possibility will be that that baby might not be weighing exactly the normal weight expected of a baby at 20 weeks. When you have this, it's called small for gestational age. Now, when you eventually give birth to your baby, possibility your baby will be low birth weight. So low birth weight babies are babies that weigh less than 5 pounds and 8 ounces at birth. By default, when your baby comes early, your baby definitely is going to weigh lower. So most preterm babies are going to weigh below 5 pounds. Now, there are so many problems that will be associated with low bed weight, because when you have normal body weight, the immune system will start functioning properly. When your body weight is not adequate, the baby's immune system will not function properly, so the baby will likely get sick. Some babies will have mental health problems, and some babies will even die. So second reason is small for gestational age and low bed weight. So please allow at least 18 months before you go for the second baby to avoid small for gestational age baby and low bed weight. Very important. Now, in a bigger spectrum, another problem that might arise when you have a very short gap between your pregnancies is the possibility of having womb rupture. So when your womb ruptures, it means that the normal architecture of the womb, which should support your baby, will not function. So your womb will practically break open, and that's a very deadly thing to happen. It's actually an emergency in pregnancy. Now, there are a couple of other factors that can also potentiate womb rupture. If you've had cesarean section in the past, if you've had myomectomy in the past, if you've had any procedure in the womb, that will put you in high risk of having womb rupture. Why? It takes a lot of time for your womb to recover before you become pregnant again. So most women that will quickly become pregnant will predispose themselves to womb rupture. So if you've had CS in the past, so assuming you just had your baby in 2021 and it was cesarean section, and you had a lot of problems during that pregnancy, you already have a risk factor. Assuming you also have multiple pregnancy. So multiple pregnancy is also a factor that can stretch your womb and predispose your womb to rupture. If you also had babies that didn't position well, so if your baby is not coming with head, if your baby is breech, if we gave you a lot of instrumentation in your delivery, we have already put a lot of pressure in your womb, so you might likely have womb rupture. If we augmented your labor or we induced labor, so we normally use a drug we call pitocin if women have some delay in labor to initiate contractions. So if a woman was given this pitocin in pregnancy and she had multiple pregnancy, she had previous cesarean section, and she didn't allow 18 months gap, the possibility she might have problems in that delivery is very high. Now, number 4 factor, which I want every woman to pay attention to. When you don't give enough gap, at least the 18 months we mentioned, you are likely going to predispose yourself to developing iron deficiency anemia. You see, when you become pregnant, you're taking care of yourself and your baby, and your body is supposed to be producing red blood cells. One of the major components in producing red blood cells is what? Iron. You're supposed to get iron from your food, but most times you might not get enough, so we supplement. So your ANC drugs will contain iron. Now, by the time you have your baby, you've lost a lot of things. You've lost some nutrients, you've lost some vitality, you've lost so many iron components in your body, because when you bleed, you're losing a lot of iron in your body. So most women who by default are pregnant will have iron deficiency anemia. So when you don't allow these 18 months to elapse before you become pregnant again, you are likely going to predispose yourself to developing iron deficiency anemia. And when you have iron deficiency anemia, your body will not be able to produce enough red blood cells. When you don't produce enough red blood cells, what's going to happen? You will not have adequate oxygen to power your body. When you don't have adequate oxygen to power your body, what's going to happen? You have a lot of body failure. So your body needs iron to make hemoglobin, which is a protein that makes red blood cells. So when you don't give this enough gap, you are likely predisposing yourself to anemia. Now, anemia in pregnancy can lead to a lot of problems, including preterm birth, including low birth weight, including postpartum depression. So we need to be careful. Now, the final point, which you have to remember, is actually the most important point. You see, when you're pregnant, pregnancy changes a lot of things. And one of the areas pregnancy can change is your mental health. You see, becoming pregnant, becoming a mother, breastfeeding, taking care of everything around the home can take a toll on you. When you are not well rested, your mental health can be severely affected. So we've had cases of women that will have maternal blues, postpartum depression, postpartum stress because you have not fully adapted to the environment. It's possible that you previously had other babies and you have other things you're attending to in your own immediate environment, and you quickly bring in another baby. You will be overwhelmed. Your mental health will not be good. Some women will develop frank depression. Some women will develop anxiety problems. And some women can actually develop psychosis. So please, allow the stress level in your body to calm down. Take good care of your physical health. Take good care of your mental health. Take good care of your emotional health. Make sure you're ready. Make sure your new baby is fully taken care of before you think of becoming pregnant again. Okay? All right. So I'm going to allow us to ask our questions. So please, if you have any questions, this is the time for your questions. So please go ahead and ask your questions and I'll provide you feedbacks. If you have any question, please feel free to ask your questions in real time and I'll provide you feedbacks. Oh, sorry. I'm going to end this now. I broadcasted from a different channel. Okay, I'm going to end this now.